Many people find out that they have cancer or heart disease when it's just too late. But an innovative scan is now available in Tampa Bay and is allowing patients to take control of their own health. Today, I head to Lifeguard Imaging, where lives are being saved through early detection. I'm with Frankie Maldonado, the Chief of Operations at Lifeguard Imaging. And Frankie, first of all, what an incredible facility this is.
Thank you. Yeah, we're pretty happy with how things are.
What is Lifeguard Imaging?
Well, we're a facility that is dealing with preventative scanning. So what we're doing is we're talking to patients who have proactive health in their forefront of their mind. And essentially, we're trying to scan them for early detection of heart disease and hundreds of different cancers before there's a symptomatic condition. The tragedy of those deadly diseases that are taking millions of lives a year is simply that when you get that first symptom, it's generally a heart attack that you're experiencing, or you have people that are discovering that they have a late-stage cancer. So everything we do is preemptive to the symptoms, and because of the scans we're performing, lives are being saved literally every day.
And I know that this is really personal to you. Talk to me about the motivation of starting and launching Lifeguard Imaging.
My partner and myself, he knew my father as well, but my father tragically lost his life to pancreatic cancer, which I understand is how you lost your father. Horrible disease. In fact, he's on the wall and the motivation behind Lifeguard Imaging. My father was a very prominent surgeon in the Maryland, D.C. area and had the knowledge to recognize that something didn't feel right in his stomach in January of 1998. Went to his hospital where he was chief of staff and told them to take some images to see what was going on, and they sliced through with a CT scanner, not too different from ours. But the traditional scanners take very thick slices, so gaps can be created. And tragically, when they came out and told him he was fine, one of the gaps I'm speaking of was on the backside tail of his pancreas, and they never saw it, and that's where the head of the cancer was. 10 months later, on November 3rd, my father was diagnosed with pancreatic cancer, and tragically he lost his life on December 18th, 6 weeks and a few days after that. It was horrible.
I personally know how you feel, and I'm so sorry for your loss. And to watch your hero, the person that you love, go like that is so very difficult. And what makes your scan different from others is that it does pinpoint. Like, if somebody had pancreatic cancer, you could catch it pre-stage 1.
That's the thing, and it's actually occurred at another facility that does exactly what we do, where I was running the operation for almost 4 years. Our scan is so fast, it's so rapidly fast that it eliminates every gap that's created with the traditional scanners, that when we pull the images off of the technology, we actually can create a three-dimensional view of the internal organs. And because of that, they're seeing every possible side, every possible internal portion of the organ, and they're capturing things in the early stages. We've actually captured pancreatic cancer in a precancerous state, and a woman had a procedure and it saved her life. And nobody's doing that. It's pretty remarkable.
And it scans more than just for cancers. I mean, you've detected heart disease. I mean, this is a lifesaver that scans from the neck down.
That's right.
And tell me all the things that you can catch, or highlights of it.
Yeah, well, the scan, exactly as you said, goes from the shoulders to the base of the pelvis. One of the biggest things, and the #1 killer, as everybody knows, is heart disease. Cardiovascular disease takes more lives every year than the top 4 cancers combined. So we have a scan that literally goes from the shoulders to the base of the pelvis, focuses initially on the chest, the abdomen region, and the pelvis. So besides scanning just the heart for heart disease, we're looking at the liver, the pancreas, the spleen, the gallbladder, the bladder, the bowels, internal organs within the torso, and finding hundreds of different cancers. And for that reason, the scans are intended on doing this, again, 100% preemptive to symptomatic conditions. And the most important thing for the patient is just having that desire to say, I want to know about it before I have a symptom. And again, because of that, lives are being saved.
Catching something early means that you can go in for treatment earlier, which is key.
That is the biggest key, because unfortunately, when the first symptoms happen, as we said, it's usually a heart attack, and now the procedures have to be performed to correct the issue. And if it's cancer, the first symptom is usually a late-stage diagnosis, which I think we both experienced with our fathers. So everything we're doing is trying to be for the people, again, who have that thought, I want to know beforehand, because the earlier we capture the disease, the better the chances of treating it and obviously surviving it. So for a patient that's getting a scan from us, we're going to get that first scan. It's a baseline, looking at everything that could be going on in detail. And then progressing after that, year after year, we're monitoring. Has anything changed? We're looking for shifts in certain shadows that might have occurred or that we've captured. And because of that, we're monitoring year to year because things will change as we get older. We get more susceptible and the immunity systems drop.
Now, is lifeguard imaging covered by insurance?
That is the only problem. It is not. I don't want to get into any healthcare issues, but tragically or unfortunately, healthcare isn't a design of being reactionary. And we're told, go see our doctors when we have a symptomatic condition, and they treat the symptom. And this is exactly what we're anti-symptom. We're trying to do it before there's a symptom. We're hoping to change that, and we're hoping to be able to contact some of these organizations to say, look at the valuable evidence of what we're doing and the lives we're saving. And we hope that someday we could be a part of that, maybe changing it so it would be a part of healthcare.
I think most people realize that getting sick is expensive, between the out-of-pocket cost, the co-payment. If you know early, you can save money, but most importantly, you save lives.
Absolutely correct. And we know there's no price to be put on the value of a life, but it truly is an expensive thing if you've had a heart attack, if you've had a cancer. Not only the price of the actual procedures, the surgeries that are performed, but the medications that need to be prescribed ongoing. And then, of course, the lost wages because you can't work, and the devastation to the family. Ultimately, that's an ancillary benefit. The most important thing is we're going to be saving lives. But it is a great side note to think that you can save potentially hundreds of thousands of dollars from these deadly diseases.
Well, I'm super excited to learn more about lifeguard imaging.
We are so happy to have you here, Gail.
Lifeguard imaging is a great way to take control of your health. And if you call right now, the number to call is 813-524-1010, or visit lifeguardimaging.com. You can receive a complimentary heart scan and a consultation when you mention Gail and Bloom. So don't put it off. You know, nothing is more important than your health. Again, call now, 813-524-1010. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Lifeguard Imaging.
You're watching Bloom, presented by Lifeguard Imaging, scanning the body for early detection of heart disease and hundreds of different forms of cancer. Call now, 813-524-1010 for your complimentary heart scan.